In this video, I'm going to go and look at the top 13 COVID-19 comorbidities or COVID-19 underlying medical conditions. So the number 2 disease did surprise me somewhat. So if you're interested to see what the number 2 disease and obviously what the number 1 disease, stay till the end of the video. So let's start off with the countdown and let's start off with number 13. Number 13 are autoimmune diseases. And autoimmune diseases are diseases which attack your own body. That's why you're more likely to get infected. They make up around 3.1% of all morbid or underlying conditions. An example of an autoimmune disease is lupus. The other condition is not really a condition, so to speak, and it makes up 3.8% of all other underlying conditions which might be associated with COVID-19 are all other diseases. So there are a lot of diseases which are associated or have a higher risk factor with COVID-19, and all other diseases are sort of categorized together. The number 11 condition or comorbid condition or underlying condition are GI and liver diseases. So GI diseases, there are certain diseases which can be involved, Crohn's disease or ulcerative colitis, hepatitis B or hepatitis C, and these make up 4.8% of comorbid infections. 10 is quite interesting because this makes up nearly 10% or 9.8% of conditions, as it's having no condition at all. So these are people who are infected who do not have any of these risk factors, and it's quite worrisome because when you think about 10%, that means every 10th person who is infected does not have a condition, and this I think speaks to the virulence and to how infectious and dangerous COVID-19 is. The number 9 underlying condition or comorbid condition are immune suppressive states, and especially immune suppressive states when you don't have a spleen or you are taking drugs which can suppress you, such as steroids. The next condition is a well-known condition. It's a pulmonary condition making up 13.3% of cases, and this is number 8, and which is asthma, which makes sort of sense. You know, COVID-19 does attack your lungs, and if you are asthmatic, you have problems with your breathing and you are more likely to get infected. The next condition, it's number 7, and what's number 7 is renal disease, and this makes up around 14.4% of underlying conditions. And the reason renal disease is quite interesting because COVID-19 can attack the kidney directly, damaging the kidney. And the way you know the kidney is damaged, if you have protein in the urine and the filtration system in the kidney is affected, and the way it's affected indirectly, and especially when there's overwhelming disease or sepsis, the blood pressure in your body, in your system is low. And if there's low blood pressure, that means there's low blood flow through the kidneys. If there's low blood flow through the kidneys, there's less oxygen in the kidneys, and thus the kidneys get affected and are damaged. And number 6 would be neurological disease. And neurological disease make up around 17% of underlying conditions. And your neurological diseases are quite wide, but in particular stroke and dementia. And it's interesting to know that when the brain is involved, the brainstem does also have ACE2 receptors, and when the brain is involved, it gets inflamed. There's a swelling of the brain, and the way you present is with disorientation, confusion. You're more likely to have seizures, and some people might end up even with a stroke because especially when there's overwhelming disease of COVID-19, the blood clots which go to your brain and you get a stroke. We are at number 5, and the condition are chronic lung diseases. And chronic lung diseases make up around 20% of the cases, which is quite interesting, especially as the COVID-19 attacks your lungs. One of the presenting symptoms for COVID-19, apart from fever and cough, is a shortness of breath, and you get this bilateral pneumonia. And obviously, if you have a lung disease, you're more likely to get infected. However, you would think, given the organ system which is involved, that this would be higher up in the list, such as asthma should be higher up in this list. However, it's only at number 5. So now what next? We're now already at number 4. What's number 4? Number 4, making up around 32% of all cases, is cardiovascular disease. So cardiovascular disease are diseases of the heart and diseases of the vessels. And usually when heart disease is involved, you have atherosclerosis of the heart. And if you have atherosclerosis of the heart, that means already the blood flow to the heart is involved. And if you have atherosclerosis of your vessels, that means the blood flow to different parts of your body, whether it's up here in your brain or down here in your lower extremities, are involved. And every time the blood vessels involved, that means blood flow is involved and oxygen is involved. And we know that COVID-19 probably makes your blood vessels more leaky, more likely to get clots, and these clots can shoot up to the brain, can shoot up to your heart, and shoot up to different vessels, causing blood clots, and in fact causing you to have a brain attack, which is a stroke, or heart attack, which is which involves the heart, or a lung attack, which is called pulmonary embolism, which is a blood clot in your lungs. And the number 3 disease is metabolic disease, and probably the number 1 disease in terms of this metabolic family of diseases is diabetes. And I think it's quite interesting that diabetes is this high. Although diabetes is a disease which we sometimes refer to as a silent killer, because diabetes is a disease which you don't really feel. Your blood sugar is high, and it can affect various organs and organ systems, such as, your brain, your heart, your kidneys, your vessels, your eyes, and you're more likely to have kidney damage, more likely to have heart damage and vessel damage as well, because of the way diabetes works. And also, if you have diabetes, you are more likely to be immunosuppressed and more likely to get infected. Now we're in the top 2. And the number 2 disease is quite interesting that this is quite high up in the list, and especially here in the US, it's obesity. And obesity, especially morbid obesity, when you have a BMI of more than 40. And this makes up around 51% of cases who have this as an underlying condition with COVID-19 infections. And we'll probably find out more how obesity is linked with COVID-19 infection. But one of the reasons is when you are obese, you have a lot of fatty tissue and a lot of fatty deposits, and not only a lot of fatty deposits on your exterior, you also have fatty deposits in your interior, in your inner organs, which we call as visceral fat. So you are more likely candidate to have cardiovascular disease and other comorbid illnesses as well, and you're more likely to have hypertension, more likely to have cardiovascular disease, more likely to have stroke. And when you're obese, you are in a constant state of chronic inflammation. And when you're in a constant state of chronic inflammation, you're more likely to have an infection. And you can see a correlation with autoimmune diseases such as lupus, where you're also in a constant state of chronic inflammation, and that's why you're more likely to get infected. What's the number 1 disease? The number 1 disease is hypertension. And hypertension makes up around 55% of all underlying conditions which are associated with COVID-19. So is it interesting that hypertension is this high, or is this some sort of outlier? Well, one of the ways you can probably explain it is when you get older, you're more likely to get hypertensive, and this is what we refer to as essential hypertension. And when you get older, there are calcifications in your body, and there are vascular calcifications not only in your heart, in your brain, but all over your body. So if you have calcifications in your body, that'll interfere with your blood flow, and if there's less blood flow to different parts of your body, there is less oxygen going to different parts of the body. When the virus does infect your body, it goes through ACE2 receptors, and there are ACE2 receptors also in your vessels. And if these vessels get leaky, they're more likely to form clots, and these clots can shoot off and can go to the brain causing a stroke, going to go to the lungs causing a lung attack, and go to your heart causing a heart attack. So if you enjoyed this video, please don't forget to like, comment, and subscribe, and leave your comments below, and I'll see you at the next video.